Welcome back to my channel. Today we're talking about cataracts. Natural lens looks like a Smarties. That's the lens. With age gets darker and darker, so we have to replace it with a new lens, which is a clear, has an optic and two legs. So we're gonna put it there. This is the cataract surgery. So this is the view. Top one is the Leica microscope. Bottom one is a GoPro attached to the microscope. So we open the wound, which is a 2.75 millimeter incision in the temporal part of the cornea. We're injecting here xylocaine with phenol 10 to dilate and freeze the eye. This is an endocoat, which is a thick, clear material to protect the cornea from the back, and putting some in the front so that the nurse doesn't need to keep putting water in the cornea. And then there's a second incision, which is 0.9 millimeter, 2 millimeter deep, each of these incisions. Now I'm going to mark the what we call capsulorhexis. So we're going to open the front of the Smarties to eat the chocolate inside. So this is what we call capsulorhexis. So we go in with the forceps, and we open an opening which measures 5 millimeters. This is the little marker that I used at the beginning to mark where we're going to put this. So we completed the capsulorhexis. This can be done manually like this or through the laser, femto laser. So this is a manual one. This is what we call hydrodissection, hydrodelineation, nuclear rotation. It's simply splitting the different layers of the Smarties inside so we can remove it safely, each step on its own. So we start by dividing this core of the Smarties into multiple quadrants, and we remove them one by one using the phaco handpiece. The tip is a vibrating solid titanium with an opening inside, so it sucks out the broken up lens material. So surrounded by a silicone sleeve which irrigates fluid inside, and the fluid will take the fragments out. So we removed half of the cataract so far. I'm going to remove the second half, divide it into quadrants, and remove it like pieces of cake. So the most important thing here is to protect the capsule so we don't open the capsule, which is the shell of the Smarties, because that's how we're going to put the new lens on. So I remove the core, then what we call epinucleus, and the last piece here. And then we come out, try and remove the last piece. Now we're going to go use the J cannula. So the J cannula will be used to what we call irrigation aspiration. There's no aspiration here, so instead of the irrigation aspiration, so it goes in, takes all the material that is still attached to the shell, which is called the capsule, and clean up the shell so that we can implant the new lens on. This is safer than irrigation aspiration, as the irrigation aspiration, it can aspirate the capsule and result in capsular tear. So this is safer. We're going to do it later once the lens is inside, so that we can use the lens as a shield to protect the capsule from being captured by the irrigation aspiration tip. So the J cannula is almost done there. Coming out. Now the lens is going to be implanted. This is we are injecting here Helon, which will inflate the capsular bag to create more space for the new lens coming in. This lens is called eye-hands lens from J&J, and it gives you a little bit more intermediate vision in addition to the distance vision. So the lens goes in folded through the 2.7 millimeter incision, goes into the capsular bag, and starts opening to fill the bag. So you can see the two legs holding hands in the middle. It's gonna split in a sec here. This is now the irrigation aspiration. I'm doing that after I implanted the lens, so I'm using the lens as a shield to protect the capsule from being captured by the irrigation aspiration tip. So you can see the arms are opening to fill and hold the lens in place. Within the capsular shell or capsular bag, like the shell of the Smarties. Now I'm going to go with just irrigation, passing fluid underneath the lens and top of the lens, positioning the lens. I like to keep the lens position at horizontal position. OCD from my side. And then I'm removing the viscoelastin from the surface of the cornea, which is the endocoat. And you can notice that the very thin edge of the cataracts is covering completely the optic. So this will decrease the chances of PCO, pseudocapital aspiration. Now I'm hydrating the wounds using moxifloxacin antibiotic and injecting antibiotic inside the eye, so that will prevent infection, which is one of the worst complications of cataract surgery, having endophthalmitis or infection inside the eye. I use the dropless injection, so I'm injecting long-acting steroids, antibiotics in the bottom, in the white of the eye, under the conjunctiva, and that will be it. Thank you for watching, guys.